Good afternoon, everyone. I'm so happy and so glad that you were able to join us here. Some of you on your lunch break, some of you just kind of out and about with your day. My name is Jim Morrison. I'm a registered dietitian here at Align Modern Health. And today we are just going to be going over a beginner's guide to proteins, fats, and carbohydrates. So this is very umbrella type information. It's not necessarily specific. We will get into a few examples, but I do encourage you that we will be taking questions at the end. So if throughout the presentation, feel free to throw questions in the Q&A box. And if at the end of this presentation and after end of all the questions, you feel like you still would like some more information pertaining to your individual self, we do offer free consultations and you can come in and see us. So to begin, here at Align Modern Health, we take an integrative approach to medicine. So this means that we utilize acupuncture and physical medicine, including as well as massage therapy, along with chiropractic, along with functional medicine and clinical nutrition. And so we combine all four of these aspects, and all five, I should say, to give you the most well-rounded approach to treatment that we possibly can, okay? And so this is a little bit different from traditional medicine, from what you would see in a hospital. Here we more focus on behavior change, changing diet, changing lifestyle, so that you can live as much of a happy and healthy life as you possibly can. A little bit about myself. Again, my name is Jim Morrison. I'm a registered dietitian. I have a Master of Science in Nutrition, as well as a Master of Science in Kinesiology from Southern Illinois University. I have a Bachelor of Science in Nutrition from Western Illinois University. Some specialties of mine tend to be helping individuals either gain or lose weight in a healthy manner, working with eating disorders, as well as just disordered eating behavior. I've worked with individuals from ages 8 to 80, I like to say. And so disordered eating behavior tends to permeate a lot of our culture, and so it's a big passion of mine, and so I tend to work with several individuals and have for quite some time. And then I also work with individuals who are pre-diabetic or have diabetes, both type 1 and type 2. And then I also was a sports dietitian and have experience with athletic performance support, and anything from more running, long distance sports to power sports to Olympic weightlifting. And I've had athletes in the NFL and in the Olympic space. So to delve in, what we're going to talk about today is what are macronutrients? What are they? Why are they important? What do they do for the body? Why is it important for them to be balanced in our everyday nutrition? As well as what is nutritional counseling? What will it look like if you were to come in and talk to myself or talk to several of the other dietitians, and how those conversations would go, how that support would look like, and how that would integrate into maybe some other treatments that you're receiving here at Align Modern Health or wanting to receive. So what are macronutrients? So we have our proteins, which are typically 4 calories per gram. They're nitrogenous compounds, meaning that the base of the molecule is formed around a nitrogen. If you remember back to your good old high school chemistry class. They're primarily found in animal products and then as well as plant products too. And the proteins found in animal products are what we call complete, meaning that they have all the essential amino acids that we need to take. And then our plant products, there are some that are complete, but primarily the majority of them are what we call complementary, and where we need to combine them to get the amino acids that our body needs. And why that's important is more for individuals who choose more vegetarian lifestyle, vegan lifestyle, and knowing how to pair those. We have our fats, so that's 9 calories per gram, and they're molecules of glycerol and fatty acids, and they can take all kinds of wild shapes. They're found in both animal and plant products and present as waxes. If you look on plants and you see like a shiny, the leaf around the outside seems shiny, that's part of the wax. You present in vitamins, sterols, and phospholipids all throughout our body and are very important. And then we have our carbohydrates, which are also 4 calories per gram, just like our proteins. And they come in various sizes and shapes as well. We have our simple, which are small, and then we have our long chain or complex carbohydrates. And these are primarily found in plant products. However, they are found in animal products as well. And so proteins, what are they used for? Okay. So proteins are primarily used for building muscle, essentially repairing the body as we go through day to day. You don't necessarily have to work out for wear and tear to happen to your body, right? And so we need those proteins to continuously help repair and overturn cells that are functioning within our body. They help with our intestinal support and digestive function. We don't really think about this, but there's a bunch of muscle around our intestines that help move and help digest the food that we eat. And then also hormone balancing too. And so some primary sources of proteins from a animal standpoint are going to be your meats, fish, eggs, cheeses, and milk. From a plant standpoint, we have our tofu, tempeh, soybeans, chickpeas, beans. There are going to be some proteins in nuts, chia seeds, hemp seeds, and quinoa. However, the primarily protein-dense foods are going to be those animal sources. So if we are deciding to utilize or to follow a more vegetarian-based eating style, knowing how to pair those is very important and can be talked about with any of the dietitians here. We have our fats, which are used to store energy, right? So these are why it's 9 calories per gram, is because they are more energy dense. So our body likes to store them for energy. They help work as signals and protective barriers throughout a lot of our body, help with cell membrane support. Not all fats are bad, okay? So we have our unsaturated fats found in fish, avocados, olive oil, nut butters, and those are going to primarily what we call our healthy fats. So this is where we want the majority of our fat intake to come from, our unsaturated fats. We have our saturated fats, which to make it easy to figure out what a saturated fat is, they are solid at room temperature. So we have our butter or ghee, which is a clarified butter, coconut oil, palm oil, meats and cheeses. If you were to look at the meat and the marbling in the meat, that's the fat in the meat, the stuff that gives it the good taste. And then we have our trans fats. These are the ones that we typically want to stay away from. And trans fats are a modified form of a saturated fat that, as scientists tried to create a fat alternative back in the 80s and 90s, I believe. And however, what we found is that in a diet that is high in trans fats, we have an increased risk of just overall inflammation, but also increased risk of cancer, diabetes, heart disease, things that really impact your ability to live a long and happy life. And then we have our carbohydrates, okay? So this is our where our body primarily gets their energy from. Our body can produce energy, like I said, prior to fats and proteins, but that requires a little bit more of chemical processes to take place in our body, where carbs are quick energy. And so they supply us with in-the-moment energy versus stored energy. So our stored version of carbohydrates is called glycogen, and we typically store that in our liver and in our muscles. And so with depending on the type of carbohydrates we're eating and the lifestyle we're living, will also affect will know the effects that carbohydrates have on our body. So we might see more energy spikes, have some dysregulation with blood sugar, which is typically known as diabetes. And so it is important, but obviously we don't want to overindulge too much because too much of anything can be a bad thing too. And so we have our simple carbs, which are our basic sugars, fruits, rice, potatoes, white bread that are good for quick energy, good for if you're just going to eat something for either pre-workout or post-workout. And then we have our complex carbs. So beans, oats, sweet potatoes, quinoa, things that tend to have more whole wheat pasta, tend to have more fiber in them, that digest a little bit more slowly, that take a little bit more time. but don't give us our spike. So I like to say simple carbohydrates kind of make our blood sugars kind of go like a roller coaster, where complex carbs is a nice drive through the hills. All right. And so what does it look like when it comes to balancing micronutrients? What does it look like? What does it look like compared to the lifestyle that we live? What does it look like for our goals? And so the benefits of balancing micronutrients in general are, again, those blood sugar regulations, avoiding the roller coasters, and getting more of that nice hilly drive, bowel movement regulation, decrease in inflammation as well. And then we also just want to avoid bloating, gas, discomfort, constipation, diarrhea, though a lot of people deal with those things on a day-to-day basis and they've kind of become commonplace. It's not a natural state for our body to be in. And so we really want to try and mitigate those as much as possible. And that's why balancing micronutrients, not only at the big scale for our macronutrients, but micronutrients too, will help mitigate those things. And so when it comes to balancing, what does it look like for an easy comparison of an athlete's diet to a desk worker's diet, right? So if a office worker, or you're sitting at your desk, if you were to eat an athlete's diet, what would most likely happen is that you would simply just sit there and gain weight, and gain adipose tissue, gain fat, because you are not exerting the amount of energy that an athlete has. On the flip side, if an athlete were to eat the diet of a desk worker, which requires fewer calories throughout the day, they're not as active, not going to need as much carbs, not going to need as much protein, the athlete's not going to be able to perform at their best. And in fact, they're probably going to end up losing muscle and losing performance gradually as that continues. Then we have inflammatory conditions. Different inflammatory conditions could be affected by certain food sensitivities that you might have, food intolerances. And so working with the dietitian, finding out what those foods are, and working with the functional medicine doctor as well, and helping build a diet, build a food style, as I like to say, around avoiding those foods so that you can live a more comfortable life. You're not dealing with the bloating, constipation, diarrhea, sharp pain that is not natural. Individuals with diabetes, there's a difference between what an individual who has type 1 compared to an individual that has type 2, and their needs too, and how we address those. Where an individual with type 1, is still concerned about carbs, but also being more cognizant of matching their carb ratio to their insulin ratio. Whereas an individual with type 2 diabetes, depending on the etiology of that, so where that this blood sugar dysregulation is coming from, might depend on the best approach in helping deal with that. And so not only with resistance training, but also the amount of carbs being eaten. And that might vary person to person depending on how your body reacts. And then also too, working with a dietitian, there are various individuals and various religions out there, individuals with ethical concerns when it comes to animals that need additional guidance, need additional support to make sure that they're getting a well-balanced diet or getting the supplementation that they need for things that they maybe don't feel comfortable eating. That's why it's important to work with a dietitian, so we make sure that we are filling all those gaps in our diet. And so here's just a slide describing some balancing snacks, because we all, as a society, as an American society, are very much on the go. And so trying to find 2 macronutrients that help provide longer lasting energy. And the reason why we want to try and shoot for 2, and typically a carb paired with either a fat or a protein, is really because that's going to slow digestion. That's going to, again, not give us those blood sugar roller coasters, but give us those nice hills. And so pairing things with like a nut butter and some type of fruit, apple or a banana, guacamole and raw carrots, or some chicken, olives and some snap peas, raw nuts and beef jerky. Those types of things are going to help sustain us help prevent those blood sugar rises and falls, and as well as help reduce cravings too throughout the day. Because a lot of individuals, which makes sense, we're taught calories in, calories out, right? And so if we are trying to lose weight, we decrease the amount of calories in. However, how a lot of individuals tend to go about doing that is tend to maybe only eat 1 or 2 meals a day. And that can end up having an opposite effect. We need to be eating consistently throughout the day to help keep our gut primed and mobilizing. So working with the dietitian on balancing meals so you are decreasing the amount of calories in. However, we're still eating consistently throughout the day so that you have consistent energy and you're not having energy droughts throughout the day. So clinical nutrition, what are we? What does it look like when you work with us? How do we operate? How do we pair with other practitioners here at Align Modern Health? So what to expect when you come in and see us. So we are a subset of functional medicine. We do offer that 15-minute consultation. However, if you would like to work with us, we either need a referral from your PCP or for you to meet with one of our functional medicine doctors here, and then they can refer you to us through them. And with that, we're just going to be asking you, the first visit typically lasts about an hour, and we're going to just be asking you various questions, kind of what we talked about, or what I've mentioned in previous slides regarding, how's your gut health? Are you bloating, constipated, anything like that? What does our food intake look like right now? What have we eaten in the last 24 hours? How's our sleep? How's our stress? What are we doing to manage that? What's our physical movement? Hydration, those kinds of things. And admittedly, they may be similar to what you might talk about with a functional medicine provider. It may seem redundant. However, I like to say I'd love to get the information from you rather than just simply assuming it from the note from the provider, right? It's better to just get the information directly from you. So we go over those things and kind of go over those nuances. For myself, I tend to take a history also of if there's any type of disordered eating behavior in the past, whether it's formally diagnosed or maybe you feel and know that, hey, what I was doing necessarily wasn't the best and the motivations behind it wasn't the best. So there's just going to be some additional questions asked, and we build, that's how we best get to know you. And then at the later half of the conversation, we'll delve more into maybe some of the suggestions the functional medicine provider has, or some of the suggestions that come to mind as we're getting a history and getting to know you more about how we can formulate the best plan of action to not only meet your goals, but also meet where you're at in life. Because if we just give you a meal plan and tell you, hey, we need to eat this, this, and this, we need to cut this out, but it's not necessarily viable right now. It's maybe there's not only are you busy, or there's other things going on in life, but also the thing of things are getting more expensive, and so we may not be able to afford it. So we really try and meet you where you're at so that we can support you. And ultimately, we will give you our professional opinion, but it is your body. And we are going to support you regardless and try and help you attain the optimal level of health that you'd like. And so as clinical nutritionists, we're also not the food police. We're not going to judge how you've been eating, what you've been eating, what you crave in secret late at night. Not our job, right? I'm a dietitian and I love a good piece of cake too. I love a pizza, all right? We're not judged. No one's perfect. And so don't feel like you need to, if let's say if you were to start working with us and we have that initial visit and we put some things in place, and we come back for a follow-up and things didn't go as planned, just be honest with us. We're not going to judge you. We're not going to get aggravated. We're going to work with you to figure out what went wrong, what we can do. Maybe we need to take a step back on the goals that we set to maybe make them a little bit more realistic with everything going on, and build that with you. We are here to walk with you. We're not here to push you. And just like I said, we're not judgmental about and also lifestyle choices too. We're not judgmental about any lifestyle choices at all. Again, we are here to walk with you. And we, again, reiterating, we are not critical. And obstacles come up. Things come up that aren't as planned. Life happens, and we totally understand that, and we deal with that too every day. And so we're not going to hold that against you by any means. We're just going to keep supporting you. We're going to keep getting through things, and keep finding different ways that maybe we can attack a situation so that we give you the highest chance for success as possible. All right, and so again, we do have a free 15-minute consultation with the dietitian. You don't need to meet with a functional medicine provider to get that consultation. That's strictly if you know that you would like to work with us. And you can schedule that by calling, and I'm going to just say this just for those individuals who may be listening and not being able to look at the screen, by calling the number 773-692-6700, or by visiting us at alignedmodernhealth.com. And so now we're just going to delve in to some Q&A questions. And so let me pull this up here just so I can see it more clearly. So we have, how balanced are prepackaged protein drinks, which is a great question. When it comes to prepackaged protein drinks, looking at the label, for example, those Premier Protein that's found at Costco, those primarily are just protein dense. So they have a very low amount of carbohydrate. They're great for if you were to, let's say, include them into a snack or a meal, pairing them with another carbohydrate or and another fat source, just to get those balance of the 3 macronutrients. But they are just a great protein source in general for individuals who are very active, on the move, need something quick, or individuals who we know we're not hungry all the time, but we know we need to eat, and maybe we just need to have a little something. And so something like a liquid protein does tend to be very helpful in those situations. What apps would you recommend for food tracking? So the difficulty is with apps. What I would actually suggest best for food tracking is tracking it yourself, keeping a notepad or keeping a journal if you do want to go the tracking route, simply because a lot of those databases, they are individuals that are just putting them in by themselves. There's no real checks or balances to it, and so you don't really know the truth of the information that's on there. And so just keeping a journal and being mindful. You see the food label in front of you, you're reading it, you know what you're ingesting. When it comes to specific things with children, I do suggest just to reaching out to us and setting up that free 15-minute consultation, just because it can that's a lot of information to delve into, and just in this conversation right now. What are your thoughts on supplements, mainly fish oils, for joints? Do you think someone just ate more seafood that effects could be the same? Yeah, I'm very much a proponent of food first. If you do have a seafood-rich diet, or a Mediterranean diet for that matter, things like fish oil would kind of be redundant to take. Do you determine? Oh, here's a good one. Okay, so determining the number of carbs per serving. Do you deduct the fiber from the total carbs? I do not deduct the fiber from the total carbs, and I'll explain why. Because then that kind of gets into what I call the justify process. Well, if I take this, but it has so much fiber, then I can justify eating more of it. And that may not be the case for you specifically. However, that's just kind of what I've seen, and that, in I'll say a moment of weakness, just looking at the carb in general is just kind of going to be a safer bet. And looking at the fiber as well, because fiber is important too, but not deducting that from the total carb. Okay, so what does counting macros mean? Counting macros means you're taking, instead of just simply looking at the total calories per day, counting macros means you have macronutrient goals. So you'll have goals for the amount of protein, carbohydrate, and fat that you will have each day. And so why that tends to be a little bit more successful than just looking at calories is because you are getting a greater variety. So there's going to be less, I should say, hypothetically, there will be less holes in your diet that way, and you're getting a more well-rounded diet, as well as, again, going back to the blood glucose control. Yeah, I think if you're looking, if the goal is to drink more water and sometimes you need to add something to your water, that's fine. I will say, not, for example, the Mio squirt bottles, not, putting a whole thing in a water bottle, but if you need to add a little bit of flavor to your water, just so you're drinking more water and staying hydrated throughout the day, that's totally fine. I do that too.
Hi, Jim. Just a friendly reminder to please read the question as well as giving the answer so all of our guests understand what you're talking about. Thank you so much.
Oh, yes. Yes, sorry. So that was a question regarding using a water additive, just a water flavoring to water, and if that's okay or not. When it comes to determining your macros and everything like that, I really would suggest reaching out to a dietitian. Not mainly because you can look it up online. However, you're not going to get that personalized um, that personalized aspect to it. A calculator online is not going to know your lifestyle and know how best to adjust for that. And so getting with one of our dietitians is going to be the best bet at figuring out where your macros and where they need to lie. What are your thoughts on powdered greens and adding to water? I think primarily, if you are able to get your greens through your diet, that's going to be the best. However, if that's something that is difficult just for your lifestyle, then that could be an option. However, know that it's just not going to be nearly as effective as getting those greens and fruits and vegetables from whole food. All right. And again, this is just kind of a broad statement when it comes to calculating macros and how much macros. Again, getting with one of our dietitians is going to be the best bet, just so we can sit down and have a conversation. Do we need to stop eating rice to lose weight? No, you do not. It comes down to I should say 9 out of 10 you do not, if there's a certain sensitivity or intolerance possibly. However, with that, it mainly comes down to just the amount and making sure that we are eating an appropriate amount and not eating a lot of it in one sitting. All right. Well, I want to thank you all for your questions and thank you all for tuning in. I really appreciate your taking your time out of your day. I know it's something that I very much appreciate. Any time nowadays that anyone's willing to take out from their own personal day is very pertinent, is very special and important to me. So thank you for joining us. If you have any further questions, again, please reach out to us so we can set up that 15-minute consultation. And I hope you all have a great and safe weekend.